Guys, what's up? Welcome to TSP TV, and in this episode I am going to be sharing with you a little article that I came across the other day, and I've been meaning to make a video about before now. Please excuse me in my tardiness, but this little video article rather in this video will hopefully shed a little light on the rise in COVID related patients, should we say, that are showing up in the United States. And according to the John Hopkins doomometer COVID tracker, the numbers are rising exponentially, and the curve is showing no signs of flattening anytime soon, if we are to believe, in fact, that these figures being supplied to us from the John Hopkins are indeed accurate. And the little article that we are going to look at might even shed some light into the inaccuracy of those figures. So it says here, look, COVID-19 economic stimulus deal passes Senate with billions in hospital funding. Very important to remember, there's billions in hospital funding. So there's a good old map of the United States, and there's lots and lots and lots and lots and lots of dollars there being thrown around. And, you know, pretty much as soon as this was announced that it was a global pandemic, and states of emergency were declared around the United States, stimulus packages were being spoken about in the trillions. And the healthcare industry, it looks now in the United States at least, is going to be getting quite a few bailouts and handouts and subsidies from the government. That was a bill passed in the Senate for roughly $2 trillion. Here we go. We can see it. My eyes are a little bit squinting. What we're trying to say. So the Senate on Wednesday passed a roughly $2 trillion COVID-19 economic stimulus deal that includes billions of dollars to bolster the healthcare system. There is much more money for our hospitals, for our nurses and physicians, for our nursing homes, and for our community health centers to do the job they need to do, Senate Minority Leader Chuck Schumer, DNY, said. So as I said, there's a lot of money that is being made available to the healthcare, and, you know, maybe quite rightly so if there is a pandemic in stuff like this, and you know, if not the virus is real, then by all means, those that are fighting this on the front line, and front line is being a term that we're hearing quite a lot about health workers. These are the front line, a little bit like a water, and the front line infantry are out there doing their best to fight away the hidden enemy. In this case, the hidden enemy is the COVID-19 virus that seems to be exponentially growing in the United States. But anyway, the senators that got together unanimously, 96-0, passed this package, which includes $100 billion of taxpayers' dollars, I like to add there, to reimburse providers for COVID-19 related expenses. So let's just break that down for you. So the Senate and the government have come together to bail out the providers, not the victims, not the patients, not the guys and individuals on the front line, the providers that are losing expenses and lost revenue as a result of COVID-19. Now in the United States, you have to pretty much have healthcare coverage, unlike Canada, unlike the United Kingdom that has a national health service or publicly funded health service. And again, it's not free. Don't think it's free. It is paid for by tax dollars, and taxation is indeed theft. But as I said, we do have a different structure in Canada and in the United Kingdom to the United States, and individuals are indeed required to have healthcare. So pretty much anybody in the United States that feels as though they has some kind of symptoms of COVID have to go through their insurance brokers, have to go to a designed, get approval, and then go to a signed doctor, general practitioner or health center to get treatment. And then the insurance company is going to pay some of the, they might have to pay a few bucks out of their own pocket, but the insurance companies are going to be picking up the bill for the remainder of the treatment, unlike countries that have a public health service available to them. And even then, you have to pay a little bit of money for your prescriptions and stuff like that, but making appointments to see doctors and going to hospitals, that's something you can kind of just do. You don't have to get pre-approval for, and don't have to go for your insurance companies as you do in the United States. So that has sounded the alarm that they needed funding to support operations, expand surge capacity, and buy protective equipment in this package. And he pushed for increased funding for hospitals in negotiations with the Trump administration officers. So again, they're bailing out providers, not the hospitals, the providers of the healthcare, and that is the insurance companies, because nobody in the hospitals in the United States are doing anything unless they have the authority from the insurance company, and the insurance companies surely are losing money here. But there's also money and funding being made available to these hospitals also, for anybody who is treating COVID-related patients or symptoms. So if you go to the hospital and you have to, an individual is diagnosed with having COVID-19 symptoms, and they have to file a report and administer medication and such forth that is appropriate to fighting this, which what we have available at the moment in our capacity, because there doesn't seem to be a cure, and people are talking about vaccines and stuff. So maybe they just need a little bit of remedies or something to help them through it, the cold and flu-like symptoms. There's been speak of malaria tablets is being a possible cure or remedy for the COVID. But anyway, they have to report this as a COVID-related disease, and due to this new wonderful billions and billions of dollars stimulus, and there's more money to come for them, now they are going to actually be reimbursed for that treatment. So pretty much anybody that comes, it's a money-making scheme, really, and a scam possibly that is being taken advantage by healthcare workers, because now in the hospital you might go in with a broken arm, or have an asthma attack, or maybe you've got appendicitis, pains in your abdomen. You go to the hospital and all of a sudden they're going to test you. Oh look, turns out you got COVID. We need to put that down as part of your treatment, and as a result then this file can be filed for reimbursement as part of the stimulus package. So it's a money game. Follow the money, guys. You see where this is going, and you see who is profiting and benefiting for this. That there is going to be a lot of people that provide insurance that are going to be using COVID as a way of gaining reimbursement, and possibly even profiteering from this. Somebody always profits in any crisis. Take advantage of it. So the House plans to vote on the bill on Friday morning using a procedure which would allow members to articulate their objections to the legislation while not requiring all members to be present in the Capitol to pass it. The American Hospital Association on Wednesday supported the bill and called for its passage, but said we need more to be done in subsequent legislation. This bill includes important provisions that will help us respond, including the creation of an emergency fund grant program, additional support for taking care of COVID-19 patients. So again, they're going to get more money for taking care of COVID-19 patients. So even if you have other symptoms that aren't exactly COVID-19 related, they're going to treat you and take care of you for COVID-19 as part of their, wonderful all-caring package to make sure that you're safe from all viruses and illnesses. And then again, they can put this on your medical reports and file from reimbursements. And relief, sending out cuts among other provisions. AHA President and CEO Rick Pollock said in a statement that the AHA, American Nurses Association, and the American Medical Association lobbied for $100 billion to support operations, while the Federation of American Hospitals had asked for $225 billion. Lots and lots of money being floated around here and being offered to these people to help fight this COVID case. And again, it's about reimbursement and looking after the big investors rather than the patient and the individual on the street that may be suffering from these symptoms and may not even have symptoms related to COVID at all, but somehow are finding themselves being diagnosed as having these. And this explains why, because now hospitals, health providers, all these things, insurance coverage, they can be reimbursed from the government for anybody that is associated to having COVID-like symptoms or needing any COVID treatment. So, Senate Appropriations Health Subcommittee Chair Roy Blunt, my goodness, that's a mouthful, said he was satisfied with the package and had pushed for the $100 billion in the hospital funding throughout negotiations. Though he said Congress still needs to take another step on coronavirus relief. I feel partly good about where we are at with the hospitals. We are at with personal protective equipment and where we are at with both the HHS, Assistant Secretary for Preparedness and Response, interesting, and the CDC, all private agencies that are funded by the government and taxpayers' dollars. Congress also set aside $16 billion for buying medical supplies for the Strategic National Stockpile and $1 billion for purchasing under the Defense Production Act, which the Trump administration has resisted using so far, despite the calls of hospitals, doctors, and governors. The American Medical Association also is generally supportive of the legislation and is praised the investment in medical equipment. While we still must review the entire stimulus packet, we appreciate that the legislation attempts to increase access to the personal protective equipment for physicians and other health professionals on the front line, and especially those that are doing the TikTok dance challenge. You must get enough PPE for these guys doing their choreographed, time-consuming dance routines for TikTok, because it just wouldn't be the same if they weren't in their PPE for these videos. It just wouldn't have the same effect. But anyway, sidetracked there. The legislation would suspend the Medicare sequester to boost provider payments. The sequester, which reduced spending for most benefits by 2% starting in 2013, would be suspended by May 1st to December 31st, 2020. However, the sequestrian would be extended an additional year past its original date. The suspension was top priority for hospital and physician groups. Hospitals would also get a 28% add-on payment for inpatient care for COVID-19 patients. So they're getting an extra 20% on top of what they're getting already for anybody that they are treating with COVID. So this is why, guys, we're seeing that curve do anything but flatten, and the numbers are rising because they're getting stimulus handouts of 20% for anybody who has COVID-19 and is a patient with COVID-19 symptoms. That's why almost anybody who's going to hospital these days has COVID-19, and anybody who's dying at the moment is got COVID-19, and why pneumonia and influenza and other such respiratory death illnesses that cause death, these numbers also are lower than normal, whereas the COVID related stuff is off the chart. The deal would extend Medicare and Medicaid programs that were set to expire on May 22nd until November 30th, setting up a potential vehicle for legislation to ban surprise medical bills and address prescription drug prices after the 2020 election. So I'm not really that knowledgeable about what all that is involved. You might have to look into that yourself, but I'm pretty sure that's trying to save them some money somewhere along the line. The White House has pushed for a surprise billing ban and for price transparency language that was ultimately left out. The Greater New York Hospital Association, another hospital association, can't have enough of those, you see. A powerful force in Schumer's state told members that the group advocated strongly against the policies. We also pleased that the extraneous measures supported by the Trump administration, such as surprise billing and price transparency provisions, were not included in the final legislation, the GNYHA said in an email to members. Cuts to Medicaid appropriate share hospital payments would be delayed through November. Through hospitals had aimed for a 2-year delay. The package eliminates $4 billion in fiscal 2020 cuts and reduces 2020 cuts from $8 billion to $4 billion. Community health centers would get 1.3 billion in emergency funding, but their main funding stem was only extended until November the 30th. The National Association of Community Health Centers has asked for at least 2 years extension in federal funding. Again, maybe there's a reason they're only giving the health centres till November, because maybe by the November they might change and become part of some kind of singular government healthcare system. The bill would allow more hospitals, including critical access hospitals and cancer centres, to request advance Medicare payments based on prior year's payments and pay them back over at least 12 months. So you've got to pay stuff back. They're not giving you out, really helping out. All they really are helping out, as I said, are the providers and the treaters of this, not the victims. Payroll tax payments would be reduced by 50%. So again, the hospital staff, they're getting their tax bills would be delayed, and employees, including the people that work within the health system, their tax would be oh no, look, the remaining 50, it's not being disappeared, it's being put on the 2022 tax bill. So they're just going to reduce it for 1 year and then add that on top. So there's a good clear indication that possibly by 2022 we'll be running, this will be over and done with, and there'll be some kind of new system in place. I don't know, so that's just conjecture. But here is a chance that some healthcare providers with fewer than 500 employees could have access to nearly 350 billion in small business loans to help with cash flow. AHA Senior Vice President of Public Policy, Ashley Thompson, some opportunity for loan forgiveness is possible, but is reduced if business lay off or reduce pay for full-time employees. Previous draft of the bill would have excluded non-profits receiving funds from the loan program. I think there are absolutely small hospitals, urban and rural, that would be able to get these loans, Thompson said. Other funding provisions would funnel 150 billion to state and local governments, 14 billion to pay medical expenses at the Veterans Affairs Department, 250 million for increasing hospital surge capacity, 200 million for the Federal Communications Commission to support telehealth efforts, and 5 billion to the Federal Emergency Management Agency, good old FEMA. So they're involved again in a good 45 billion handout there for their efforts. The bill would require the HHS Secretary to develop and implement a new payment rule for federally qualified health centers and rural health center clinics that provide telehealth service to eligible payments. Payment rates would be based on payment that currently applies to comparable telehealth services under the physician fee schedule. Again, stuff I'm not very familiar with or unaware of. The HHS would also have to issue guidance on using telehealth for home health services. The law would allow Medicare beneficiaries to use telehealth service regardless of whether they had seen the provider in person in the preceding 3 years. Package mandates more reporting requirements about where the drug maker's source of the materials, allows the FDA to prioritize drug applications that could help address the shortage. The FDA policy would be amended so that laboratory developed test and diagnostic kits could be used and covered by private insurance plans before receiving an emergency use authorization. So they want your insurance to be paying for this before they make it available for everybody in emergency use. So if you're covered, then you might be able to get one of these diagnostic kits and test kits before the common man. Insurers would be required to pay either a negotiated price with a provider or a cash price posted by the provider for the test. Vaccines that meet certain effectiveness standards would also have to be covered with no cost sharing. America's Health Insurance Plans President and CEO Matt Iles said he supported the bill's measure to assist businesses, but indicated Congress may need to do more to stabilize health insurance markets in the subsequent legislation. Now, more than ever, we must ensure that people are able to access the care they need by assuring that their current coverage is and remains strong and stable. He said in a statement, lawmakers are already shifting their focus on the next COVID relief bill through the Senate, though the Senate does not expect to hold votes again until April 20, Hitler's birthday. By the way, Senate Rick Scott, RFLA, a former health system executive, said he would stay in touch with the hospitals as the weeks wear on. I'll keep talking to them and make sure if we need to do more, we're going to do more because they are the front line and everybody and taking care of everybody. So that's pretty much it there. And there are some comments and stuff underneath here that you could read if you wanted to. But the point of the matter is, guys, that anybody that is being treated, or any healthcare or system or any hospital that is treating somebody who has COVID-related symptoms is eligible for funding and reimbursement as part of the stimulus package that the government issued. So somehow, some way, these people who are on the front line taking care of everybody, the people that they work, I'm not saying the workers, the workforce, the nurses, the doctors, these people, not talking about them. I'm talking about the guys that own the hospitals, the CEOs, the chairpersons, the vice presidents of insurance providers, hospitals, and all these other private enterprises. These are the people that are somehow profiting as a part of this pandemic, and are they manipulating their doctor reports in order to receive stimulus funding and bailouts from the government? Seems pretty clear to me that's what they are up to, and why we're seeing such a rise in the number of COVID-related patients and symptoms in the United States of America. And this might be because, quite frankly, it would be foolish for any hospital to not contemplate somebody that they are taking in at the moment as having COVID-19 symptoms. If you see what I'm saying, like, it's in their best interests to diagnose everybody that they see with COVID in order to get more stimulus payments, if you see what I'm trying to say. So anyway, guys, I know this is a little bit long-winded and maybe my presentation wasn't the best, but hopefully you can see what this little article is suggesting and saying, and reading between the lines you can see as to why maybe the figures on COVID are rising. And this would be some evidence perhaps that there is some manipulation going on, and we could possibly maybe take a little bit of a pinch of salt with what we're looking at in terms of the figures on the John Hopkins doom-graph COVID tracker, that minute by minute the numbers go up, certainly in the United States. And each and every time that one of those do's, they're getting an extra 20% on top of whatever they are already receiving from the government as part of the stimulus package. Do the math, guys. Anyway, thanks for watching. Let me know thoughts in the comments below. This is a shit video production for TSP TV. See you in the next one. Until then, keep it thrifty.